Today, Dr. Rob is called to a young man who's been stabbed in the back.
He's got 2 wounds, one to the lower left back and one to the left buttock.
Tracy and Dan treat a woman writhing in agony.
What's the matter? Short, sharp breaths, like we said.
And John looks after a cardiac patient whose heart rate is off the scale.
So your heart rate's gone up to 158. Yeah. So you get really irregular as well.
We're going to a 33-year-old female who has rang 111 this evening because she's got stomach pain. She's got a bit of flank pain as well. She's got a headache. And that's all we know at the minute. Evening. How's it going, bud? You all right? So, where is she? Upstairs. You all right, darling? She said it's OK. Do you want to sit up for me, darling?
Oh, please don't make me. I'll sit up your head. So...
OK, that's all right if you don't want to sit up. Don't worry. Right, let's have a talk about what's going on this evening then. What's the matter?
So it started Sunday evening, just severe pain in my left side of my stomach, and my rib, and that just gradually got worse.
Yeah.
I was still able to function as normal yesterday, just every now and then doubling up in pain. And then last night, I developed severe headache and back pain. Couldn't sleep at all with it all night.
OK.
And it's just got worse and worse.
I'd been feeling unwell for a number of days, but then suddenly that day it became so intense and it was hurting to breathe and hurting if I tried to walk. And I knew I needed to get medical attention.
Have you had anything else for the pain? Paracetamol?
No, just paracetamol, regular paracetamol every 4 hours, like clockwork.
OK.
The last one was 7:30.
7:30 tonight?
Yeah.
OK, so you've had some recently, haven't you? So what prompted the call? Because the pain just got too much, you couldn't...
It's so bad, and
OK.
my headache and my back, and she just couldn't even move.
OK.
Is it all right if I do a few ups on you? Is that OK? Are you all right to sit up, or are you more... I know
It's really painful.
you'd rather lie down there. Right, I'll see if I can get to you.
Have you done your temperature or anything like that, or is it...?
No.
OK, let's have a look. There you go. You got an infection somewhere. Do you get kidney infections a lot, or urine?
I used to years ago. I haven't had a kidney infection in years.
No problems with waterworks, passing urine or anything like that?
I'm struggling to pass urine.
You are?
I've only managed to pass urine twice, but I've drunk about 12 pints of water.
Do you mind if I have a look at your tummy? Is that OK?
It's okay.
Don't worry about them. Let's have a look at your tummy. I'll come round this side. Right, show me where this pain is.
And this area here.
OK?
The
Right.
abdominal pain and then the back pain is
There, on your flank.
just under there, so travelling.
OK. All right.
I was developing intense pain in the sort of lower back either side of my spine, just sort of underneath where your ribs end. It was very, very tense, and when I tried to take a breath in, it felt like someone was squeezing something inside of me really, really tight, which was very, very painful.
In terms of what's going on, the way you're describing the pain, you've got a bit of a temperature, you've got a headache, you don't feel like eating. It seems like maybe possibly a bit of a kidney infection you've got.
Yeah, I mean, you're showing some signs of infection, and kidney infections aren't very nice, and we don't know how long you've had it. When people get kidney infections, they can be quite painful. Sometimes they've had a water infection that's not been treated, and it's just got worse. We can go to patients that have just got a bit of irritation and they're in a bit of pain, they've got a bit of back pain. And then we can go to people that are totally off their legs, they can't walk, they're confused, and it can really knock them about for a long time. I think you could probably do with some, some more tests, something that we can't do here. So, you need to see a doctor and probably get some antibiotics sorted out for you before it gets any worse. Are you happy to pop up to A&E? OK.
But before they can move her, the ambulance crew need to get Melissa's pain under control.
Have you ever had gas and air before?
Yeah.
Yeah, yeah. Should I try some gas and air? I think we'll try some gas and air, darling. Obviously, it's not going to take the pain away, but it's going to take this edge off, so we can sort of have a proper look at you without it causing you too much pain, OK?
In Birmingham are a pretty common affair, and at the major trauma centre here we get a decent number through the doors each day, if not double figures. They vary from very minor through to more serious ones and through to fatal ones, and it's part of being a decent-sized city that it's just part of the way of life, unfortunately. So it's to us, young male who's been twice. It doesn't appear to be unwell at the moment, but apparently the blade was of a reasonable size. And we'll find out what he's like when we get there in about 10 seconds, hopefully.
All function.
So when we arrived on scene, there was quite a big crowd still on the housing estate. The police had been there 30 seconds, 90 seconds before we got there, and there was an ambulance crew already on scene. There was a few shouting matches going on, that sort of thing. And it just gave us the impression that it was probably still quite a volatile environment. Knock, knock. How are we doing, mate? You all right? Yeah, 2 secs. Howdy, Chief. Hello, Tony. My name's Rob. I'm one of the doctors with the ambulance service. Hey,
Rob.
How are you feeling?
We have got a large knife this big, 2 penetrating wounds.
The gentleman had been twice, once at his back and I think once on his backside. It's not unusual to get in all sorts of strange places, and for me it's just a question of trying to identify where all of the injuries are and working out what might be damaged underneath them.
I'm Oliver and that's Dr. Rob. All right, we're going to look after your son for you, OK? We're going to pop him down to the hospital. The hospital we're going to go to is one in Birmingham, the Queen Elizabeth, all right? So there's a seatbelt just on your left shoulder. If you want to put that on, if you're going to come with us.
They'll have a look with that and that'll tell us what's going on, all right?
With victims, there's no time to lose. Rob calls ahead to the hospital so they can prepare for the patient's arrival.
Yeah, back. He's got 2 wounds, one to the lower left back and one to the left buttock. He's GCS 15, heart rate of 90, sats 100%. BP doesn't want to record at the moment, but that's probably positional because he's lying face down and he's got a good radial. So we've just canulated him and we should be at the QE in about 8 minutes, over. It didn't appear that he'd lost a lot of blood or too much blood externally. It was just down to the nature of what sort of implement he'd been stabbed with and how far inside his body that it had got. And that wasn't something that we were going to be able to find out in the back of an ambulance. That was going to need to be found out in hospital. Just going to make sure you've got a few straps on, Chief. A little ride in.
I'm just going cold, man.
You're all right, don't worry. Yeah, very shivery.
Well, one of the reasons why you're shaking is because of all the adrenaline that's in your body at the moment. That's perfectly natural. But keep you nice and warm as well, my friend, all right?
I suspect when you're in a fight, the adrenaline is reasonably high. And as you start the come-down process of that, it's not unusual to get the shakes, the fear, the realisation of what's been going on, and that's probably when you start thinking about how you're actually feeling and how cold you are.
The police believe the weapon used in the attack was a large hunting knife.
The size of the knife does matter. We go to machete attacks every so often, and for those sort of injuries you get quite impressive tissue loss, but it's normally then reasonably quite easy to see what's been injured, and you can see how deep the injury is. The ones that concern me more are the small screwdriver-like injuries where you just have no idea which direction the wound went, how far it's gone in, and what it's damaged on the way through. So you don't take any medicines at home normally? Not allergic to anything at all? Nothing at all. Okay. We'll be there in a minute. How's the pain now? Is it easing off a bit? Feeling a bit more relaxed? Good, that's not bad. You're doing really well. We get called to quite a few things over a week, but at least every other night. And those are obviously when you get called to the more serious ones. So there's quite a few that happen across the region. Most days, I would have thought. We'll take you into the little recess room, and you'll be met by about 6 or 7 people, probably. There'll be
That's special.
yeah, you're that special. There will be one big boss who'll be shouting out all the instructions, and then a few people will attack you. They might sneak another one of these little drips in, I'm afraid, and take a little bit more blood. Right, we're just going to take a few bits and pieces off you now, because we're nearly there. Well done. We'll take your feet first, mate, all right? There's the man. Given the nature of his injuries and given the nature and size of the blade, which is alleged to have been used, then he's at quite decent risk of having an internal injury associated with the location of those wounds on his body. And so let's put him through the CT scanner to see if there's any internal injuries and take it from there.
Substance abuse is probably a big percentage of the calls that we attend, particularly on a weekend. You can guess that during a Friday, Saturday night, you're going to be going out to somebody who's had too much of some substance, and it's just something you become sort of used to, and it's commonplace now. We're on the way to a query unconscious male patient. He's in an alleyway, back of a street, just round the corner. I'm guessing a member of the public has called for us. First impressions, a bit cynical maybe, but could be alcohol related. He says he's got a bottle of wine next to him, so stands a chance of some alcohol involvement. Hello there.
Found probably 5 minutes ago.
Yeah.
I think. And found this chap here. I've had a quick look through his bag.
Yeah.
There's some medication there. I've seen the bag. Tried to raise it.
All right, I'll have a look in a moment. So you were just passing by, were you?
Yeah, we live over the back, so.
Okay, lovely. Thank you very much.
Okay.
Thank you. Can you talk to me? Looks well out of it, doesn't he?
Yeah.
When attending somebody unconscious and clearly out of it, I need to decide quickly as to what's caused that. Is it a medical condition? Is it down to sort of intoxication from alcohol or drugs? So we need to ascertain through a history from bystanders or looking at the area around that patient as to how it could have happened, and then we can treat as we see and make an improvement for that patient. All right, is there any other bottles anywhere? Have you ever seen him around before?
I haven't, no. Okay. I haven't. But there's a property at the back of here.
Yeah, I'm aware of the one with the flats, yeah. Yeah.
A lot of drugs.
Yeah. Okay.
As long as you know.
Yeah, thank you. Thank you.
We live locally in this area, and we just parked up, and we sometimes walk down this gullyway, turn around the corner and saw a guy just kind of slumped on the floor. It's kind of common knowledge, really, that there's a lot of drug problems in the area. So I think we immediately thought this guy might have taken an overdose.
Would somebody do me a favour? Yeah. If you've got a spare minute, there should be an ambulance, whether there's an ambulance coming. Would somebody just park there, just point in the right direction of where we are?
Yeah.
Thank you. Let's set you up a bit, mate. Oh. Hello there, mate. Oh. Hello. You had a drink?
Yeah.
Yeah, how much you had?
A little.
A little? All right, mate. OK, how are you feeling?
Horrible.
Horrible. OK. You taking any tablets, or is it just the drink?
Yeah,
tablets. What you taking?
All
right, mate. OK. Just lift your head up for me.
Let's have a look in your eyes, okay? Open your eyes for me. Okay, keep your eyes open wide.
He smells of alcohol and there was an empty bottle of wine next to him. So that is telling me straight away that there's certainly a chance of him being sort of under the influence of alcohol. Also looking at his pupils, they were constricted. But having pinpoint pupils, that didn't tie in with alcohol use. So I was guessing that he may be under the influence of heroin or heroin substitute.
Just going to check you over, all right? Do you know who I am?
Yes.
Who am I, mate? Ambulance. All right, somebody's called for the ambulance.
Bravo.
Let's have your finger, mate. There's going to be a little scratch in your finger, is that okay?
Of course.
Little scratch in your finger. You got any pains anywhere?
I'm just...
In your chest, all right. What we're going to do, we're going to get you on the back of the ambulance in a moment when it arrives and we'll get you checked over, all right?
Although he suspects the man has taken a mixture of heroin and alcohol, Steve doesn't believe he's taken an overdose.
My assessments are that his observations appear okay at the moment, but it may be a chance that he's taken something, whether that be prescription medication or some sort of narcotic. So what I'm doing is, because he's got a bag with him, I'm going to go through his medication, just see if there's anything that could suggest that he's taken too many of something, or something that could give him the symptoms he's got at the moment. They here? Yeah. Lovely, thank you. Hello, chaps, all right?
Yes, you?
Very well, thank you. Member of the public called for us, found him slumped on the floor. He's responsive initially to pain, but he's had a chat to us since.
Okay.
Quite sort of like confused conversation, smells of alcohol. Obs are fine. I've had a look at the medication now. I can't really make head and tail of what half of it is. There's certainly nothing in there like opiate-based or you know, anything that could sort of make him like this.
Okay.
All right.
So we're going to get the bed?
Yeah, we'll get the bed.
Bed and get him on, all right.
I think the public's perception of what we do dealing with alcohol and drug-related jobs is the fact that these people are wasting our time. I don't see that as the case. I think that everybody needs to be dealt with in the same manner, with respect and dignity.
Come on, bud. That's it. Come and stand up with us, mate. Sit down.
Sit down. There we go.
Good lad.
Just swing your legs up. Yep.
How's that, mate? Is that better?
Let's get you in the warm, because you're in the cold at the moment.
Thank you.
It's okay. What's occurring today? What's going on?
What are you doing down in an alley? What are you doing sleeping in an alleyway?
No.
You were?
We're going to do a bit more of a thorough investigation now. Chances are he's some sort of IV drug user, so in light of that, there's potential that he could have had something maybe heroin related this evening. So we're going to have a good look at that, and then we'll see what we can come up with.
Once in the ambulance, the man admits that he has taken heroin.
Bit too much heroin, I think, today.
Yeah.
Yeah. Do you...
I got big enough.
Yeah. Every day?
Yes.
Yeah. Are you getting any help?
No.
No. Do you want help with your use? Answer honestly.
Yeah.
Good. Good. The first step is actually wanting the help.
Yeah, thank you.
He's a bit more with it now to what he was, and he's stated that he has took heroin today. It's not caused him too much of a problem. I think this is more alcohol related. He's not showing any signs of an opiate overdose, but the fact he's had heroin and he was in a public place, he's definitely going to have to go to the hospital. So the crew are here now and they're going to be off shortly with him. Take care.
Yeah, obviously it's difficult to see people in pain, obviously. That's something we can do something about, which is nice. But I think there's only so many only clinical skills we can be taught to treat people and stuff in pain, and there's only so many drugs we can give, and if they're sort of contraindicated or we can't give them for whatever reason, that's when you draw on sort of your talking skills and your interpersonal skills, and it definitely does help.
You know, very painful.
In Willenhall, Tracy and Dan are treating Melissa, who's got severe abdominal pains and a suspected kidney infection.
Try some Entonox. Hopefully it'll take the edge off. All right. You've had it before, so just grip it with your teeth, and then might make you a bit dry, it might make you a bit woozy. Breathe in, that's it, breathe in, hold it, and then nice, slowly breathe out. All in one breath. Then breathe in. Try and regulate your breathing. So I think you're anxious with the pain, aren't you? Is that making any difference at all? Is that helping with the pain?
No, just it hurts when I breathe in.
It's hurting when you breathe in. Melissa had already taken some of her own pain relief, so it meant that we couldn't give her paracetamol. So we had to look at a bit of gas and air for her, the next best thing.
Yeah, she had some gas in her and it wasn't...
It wasn't helping her
No,
at
it
all,
wasn't
was
quite
it really?
helping.
She was in quite a bit of pain. Sometimes we can only manage so much, and then further tests are need doing at the hospital, urinalysis, scans maybe, but something that we can't do, so we'll take her to hospital.
But Dan and Tracy are loath to move Melissa when she's in so much pain.
I think you need some more help with to manage this pain, don't you?
Oh, okay.
Why don't you try your Oromorph?
I normally take it if, like, my jaw dislocates or something like that, or my ankle. But it's not that bad.
Melissa is no stranger to pain, as she suffers from a rare genetic disorder that causes her joints to dislocate. When they do, she takes oral morphine or Oromorph.
The condition I suffer with is Ehlers-Danlos syndrome. It's a connective tissue disorder, so I dislocate my joints very easily, whereas normally you would need quite a lot of trauma to dislocate a joint. It's quite easy for someone with Ehlers-Danlos syndrome to dislocate one of their joints, and it also causes things like easy bleeding and easy bruising, and we just have to get regular checkups really.
You seem like you're in a lot of pain, and that Entonox, it's only taking the edge off, isn't it? Do you know what I mean? So would you want to try some of your Oromorph?
Well, I normally only take it when it's something really severe, like...
Obviously, that's where we'd go, is Oromorph. Okay?
And there's plenty in the cupboard, if that's what you think it is, but I would think it's not at the stage I would need the Oromorph just yet.
Okay. Okay, that's fine, yeah.
For me, yes, I was in a lot of pain. Nevertheless, it still wasn't as bad as some of the dislocations I've been through. I was explaining to him that I'd rather not take the Oromorph unless I absolutely had to, like with a really bad dislocation. That's because of the side effects I get from it, and because it's something I don't like taking very frequently.
With morphine not an option, Melissa will have to rely on gas and air for the trip to hospital.
Which way are you going? That way or this way?
Your slippers are down here.
Oh, are they?
All right. Do you want to grab the gas and air, Dan?
Yeah. Do you need any, darling? You want any gas and air? Yeah?
Thank you.
Let's take it slow. I'll go first. All right, darling. Sick bag's there. As I said, I know it's not the best, but obviously it's the best we got for the minute, innit? All right, okay? We'll go to New Cross. Yeah, happy, Trace? All right. As my colleague said, looking like a kidney infection. Obviously, with the kidneys, you have to be careful. We don't know how long she's had it, we don't know what's going on underneath. She's clearly in a lot of pain. She's clearly got quite a high pain threshold. But obviously, she's had the paracetamol, so we can't give her anything stronger there. And she needs a few further tests, basically, that we can't do. So we'll see what happens there. What's the matter? What's the matter, darling? What's the matter? What's the matter? Short, sharp breaths, like we said.
Okay.
Short breaths. Come on, don't get upset. How old's your son? When have you got him back?
My mum and dad picked him up from his football club and brought him home, said he was doing well all day today, so they went to pick him up.
Oh, so they said they'd look after him. When we got onto the truck, he was still in a bit of pain, so we reverted to sort of the talking tactics and trying to calm her down a bit. It's one of the best tools that we have, I think, without even bothering to give any drugs or medicines.
Tracy and Dan, the paramedics, were really good, lovely people, very patient, very calm, and I think you need that when you're in a lot of pain. It can make you a bit panicked or flustered, and you know you need someone who's staying calm. It's reassuring, and I think it's always good as well when they talk to you and try and distract you a little from your pain.
All right, here we are. Do you want to take the entonoxin with you, or it's making you feel sick? Do you want to give it a break then? We'll give it a break. Let's have these off, yeah? Now you're charged up.
Okay.
Yeah. Okay.
She seemed to have calmed down by the time we got to hospital. So she's feeling cold and trying to snuggle up, so I think there's definitely some sort of infection there. So hopefully they might, I don't know whether they'll scan her or just treat her with antibiotics and send her home. But yeah, job done.
Our most common call-outs tend to be chest pains or falls in the elderly, chest pains in a wide age group, really. If someone's got a pain in their chest, it's highlighted to call an ambulance, and whether or not then that's for a chest infection or a heart attack. It's such a wide range of issue, and that's why we're commonly called out to them, really. We are on the way to a 55-year-old gentleman. He sounds like he's got some chest pain. There is actually a technician crew in attendance, and they've requested a paramedic to go and check his ECG. There's some ECG abnormalities on there.
Cancelling.
Hello, all right? How are you doing? Is he upstairs? Let's try and squeeze in. Sorry. That's all right.
It's me.
Hello, mate. How are you doing? All right.
Tim.
Hello, Tim. How are you doing?
In April, he had a triple bypass, and since then he's had runs of AF. He was on digoxin for a bit. About 3 weeks ago, he come off the digoxin. He's got up this morning to jump in the shower, and he's had a sudden onset of feeling dizzy, palpitations.
Right.
He's gone very pale, very clammy. He's dried himself off. When we came in here, he was still clammy. Done a 12 lead. There was slight, slight, probably one box on 2-3 in AVF. He's got no pain as such, but he did have an ache across the back of his shoulder initially, which has since passed.
Right.
But it looks as though he's back in AF now, to be fair. I think
Tim had a heart attack 4 months ago and underwent a triple heart bypass operation. After the surgery, he developed atrial fibrillation.
Tim had what they call AF, or atrial fibrillation. It's an irregular heartbeat, so the two portions of the heart, the top and the bottom, they don't quite work in sync. A few issues that cause it by there, it can cause some turbulent blood flow in the heart, which can cause clots, hence why the patients normally go on blood thinning tablets post-diagnosis.
Tim's blood pressure is also lower than normal.
But he's hypertensive as well, 97/65, quite a weak radial.
Right, although it is low, it's not as low as I would expect you to, for you to be feeling that bad and this clammy. Worst comes to worst, if you are feeling lightheaded when we get you up, we'll just pop a little needle and give you some fluid.
Yeah.
Just to make sure we get you out, and then we can pop to us as well and get you sorted anyway. Do you feel lightheaded if we sit up? Just try and sit up for me now, even just in this position. Don't drop your legs or anything. I know it's a bit awkward like that. Does that make you feel dizzy or?
Not at the moment.
Just relax yourself back then, Tim. All right, okay. It is what we thought. It's your blood pressure.
Go down to 82 and your heart rate's gone up to 158.
Yeah.
So you get really irregular as well. So we'll just pop the needle in, we'll get you some fluid, just to bring your blood pressure up. And we'll get you out on the vehicle, mate. Did a full range of tests from blood sugars to temperature, ECGs, blood pressures, and a 12-lead ECG. 12-lead ECG allows you to look at 12 different angles of the heart to see the electrical activity of it. And obviously that was the diagnosis that we came up with AF. There wasn't anything else significantly concerning in terms of heart attacks, but it showed us the AF that it was going quick, so we needed to treat that. I'm going to jump over there if I can. So every day you get a bloke on your bed. That's better. So just cold water going up your arm.
Yeah.
You're probably used to it. There you go, mate. Right. Thank you kindly. Just basically the same as what I've just put in, Tim. Hopefully just put your blood pressure up a bit and we can get you a bit safer and B, making you feel better. Are they planning on actually looking into it any further to do anything with it, or
basically they gave me the digoxin to bring it under control, and then they say they went to see the consultant on last Thursday, and they kind of said they didn't want to see me for another 6 months, and then as soon as he said that, everything's gone.
It's good in one way, at least, if you know what I mean. At least if it is something, at least we can get you back in and quick and get it sorted. Tim's got a history of AF or atrial fibrillations. Initially he was going to have some treatment done by the hospital, but because he kind of reverted himself back to a normal rhythm, the hospital have actually stopped planning the planned treatment for him. Unfortunately, it's come back today, from what we gather. His blood pressure's dropped quite significantly, so it's making him feel very lightheaded and dizzy when he gets up. So we'll just pop the cannula in, give him some fluids, pick his blood pressure up, and then we'll take him up to the local A&E to see the cardiologist again, and see if we'll take it from there.
The team take Tim's blood pressure again.
Sit up again, or?
You can do, actually. If we just sit you up slightly.
Yeah.
Because that's what the last one we did, and hopefully we'll make some improvement on it.
That's much better, isn't it? 170.
Super. Right. What we'll do, we'll drop your legs as well.
Yep.
Before we start to do anything. If there's any change, we can take it from there, all right?
With his blood pressure back at a safe level, the team can now take Tim to hospital.
Do you feel okay, yeah?
Yeah.
His wife Sarah will travel with him.
Lay on the bed for us. We'll check your blood pressure again.
You comfy like that, or?
Yeah, it's fine, to be honest. I feel much better again.
No different to when you lay down?
Nah, not really.
Extreme caution. Rear door open.
Right. Pop that up. One more here. And we've now brought him into the local A&E, which is Russell's Hall. They're now doing further checks, ECGs, and they're going to refer him down onto the cardiology to see exactly what's going on with this rhythm. If it's going to stay, or is it just going to be a transient thing where it just comes and goes again. And obviously the cardiologist will treat it from then on after.
As a paramedic, you see all sorts of jobs, from something so minor that isn't an emergency, but that person that you're dealing with, it's their emergency, to life-threatening conditions, and you just work to your full ability to each job.
Yeah, basically, she's got it's a skin test, and it's on the base of the inside hand, like near up on the wrist. It's she's fallen over and stopped herself with a hand.
I'll come and have a look at it for you. Don't worry. Well, we're going to a job not too far away. We've been requested by an ambulance crew who are in attendance. They've gone to this elderly lady in her 80s that's taken a fall and sustained an injury to her wrist, a skin tear. They really don't need to take her to hospital because a skin tear is something that an advanced paramedic can actually do whilst in the home, and it's hospital avoidance, which we try and do as much as what we can. Hello. Hello.
Hello. This is lovely Brenda.
Hello, Brenda.
She's come home from the shop up those steps by the gate. She's had a mechanical fall.
Right.
She's landed on her arm. Broken fall. She's got no other injuries. Fully mobile. She denies any pain. Her wrist is fine. Full range of movement. She has got osteoarthritis, but like I say, no bony tenderness or deformity.
Can I have a look at your wrist?
Yep. She's got a more
Can we just move this? Let's have a look. Yeah. We can do that.
I've got your tourniquets ready, Kath.
We can fix it.
Eight.
Oh, it's bleeding again.
I know it is. You want to just hold that on for me? So we can have a proper look.
Senior paramedics like Kath are trained in wound care, so they can treat patients at home rather than taking them to hospital.
As an advanced paramedic, this is one of the injuries that we can deal with. Skin tears are ideal to be dealt with by using steri-strips, which are long pieces of thin plaster. What we have to do is clean all the wound up and place the skin back how it should be and apply steri-strips over it.
You going to drop that on the bed, sweetheart?
Yes, it might be a bit easier, won't it?
Okay.
Okie doke. Just have another little look, my darling. It's cold. It's only water.
Lovely and cold.
It certainly is. So everything else is cleaned up round it. You move your fingers okay?
Yeah.
Good. Good.
I'll play piano.
Can you?
That's good, that is, because you couldn't before you fell over.
Right. You put this on your lap. You put your hand down on your lap. That's it. You feeling okay?
Yeah.
Yeah. Yeah, small little skin tear on Brenda's hand that we can steri-strip, and she'll be able to stay at home, which I'm sure she'll be very happy about. Put that on a little bit longer. Right, what we need once we've done this, in a couple of days' time, we need to go and see the district nurse, so she can check on your wound on how it's healing.
Are
Okay?
those carers coming back?
Yeah, they're not medical.
No, I'm just saying, so
nurse.
where will the district nurse be?
Who's your doctor? Who's your doctor?
Waterfront surgery.
They've got district nurses there.
Right.
All you've got to do is ring them up,
Yes.
and they'll come out. Okay, we need it
Right.
checked in 2 to 3 days.
Okay.
That's held it together quite well. Okay. Another little dressing on it in a minute.
Stars and stripes.
You want a stars and stripes dressing? Do you?
If it is a skin tear which we're dealing with, stitches really wouldn't be appropriate because it's not a cut. It's more that the top layer of the skin has tore and rolled back. So then you can get that skin and roll it back down again, almost sealing the wound and putting these steri-strips over.
It shouldn't start bleeding again, but if it does, you just put another dressing on top of it. Don't take the original one off. Okay. Brenda? That? Fantastic. Mended?
I'll play piano.
You play the piano. That's lovely. That's lovely. Okie doke. All right. Everything's fine now,
Yes.
as long as we keep up to this 2 to 3 days. Let me
Well, to be Monday, I'll go tomorrow
Yeah.
and tell them, and then
Yeah.
ask them to call in Monday and say.
Make an appointment so they
Okay.
can come,
Yeah.
check it and see if they're happy with it and how it's healing.
Yes, okay. Yeah, no problem.
And okay, Brenda.
I call you.
Are you happy?
Fine.
Are you feeling happy?
Agony.
No, not agony. Are you happy?
Yes.
Thumbs up.
Lovely.
That's it. Okay then.
Thank you for what you've done.
You're very welcome. Okay?
Thank you.
Be careful.
Thank you for you.
Okay.
Hospital avoidance is very important. There are so many people that go to hospital that don't need to go, but if it's something we can go to and deal with them in the home surroundings, it's much better for the patient. Thank you, ladies. Yes, I will, yes. Okay, thank you.
Thanks for your help.
Brenda seems very happy in herself and extremely happy to be staying at home and not having to go into hospital. So it's a job well done, and although it's not an emergency, it's something that gives us fulfilment, and we've left her happy.